Well, I'm Dr. Banaag. I'm a professor of psychiatry. I used to teach in the University of the Philippines, but I have been retired. Now I'm a professor emeritus of the UP, University of the Philippines, Manila. I'm now actively practicing and involved in the Medical City, a private tertiary hospital. Well, Asperger syndrome is a rather uncommon syndrome, and sometimes we really do not know if it is a disorder, but it is characterized by difficulty of social relationships. Somehow, the individual who has Asperger's is unable or has difficulty engaging in meaningful social relationships. Also, another difficulty, and maybe this is the reason behind the difficulties in social relationship, there is a difficulty in being able to read the other person's mind, to be able to have a sense what the other person is thinking. Normally, when we see someone who looks unhappy, we start thinking, oh, maybe unhappy siya. Baka naman he had a fight with his loved one or her loved one. But people with Asperger's have difficulty formulating those ideas. Well, we really don't know the exact causes of Asperger's syndrome, but we know that it is highly genetic and that people are born with the potential to develop Asperger's syndrome. The syndrome becomes evident usually by the time the young child begins to go to school, because it will be noticed that this young child has difficulties playing and mixing with the peers. Incidentally, the Asperger's syndrome is now lumped under what is called autism spectrum disorder. Uh, is, the Asperger's syndrome is very similar to autism, but it's a higher form. In other words, people with Asperger's are generally of higher functioning than many of the people with autism. Well, like we said earlier, the main symptom, primary symptom, has to do with difficulties in social relationship. It's not it's not that they don't want to, they want to relate, but they don't have the social skills. They lack the social skills. I have a patient who, in fact, is now in college, had graduated, fine arts, who told me that he really wants to do, but he doesn't know how to initiate a conversation. So, the social relationships are very much affected and impaired because of that difficulty. It is really a brain problem. It's not an emotional problem. It's a brain problem that affects the way the individual with Asperger's syndrome, the way this individual thinks and sees the world. Well, like we said earlier, the characteristic is they tend to shy away from social groups. They develop friendships, but these are highly selected friends. They also tend to be focused on certain things only, and when they're interested in something, they are super focused on these things. You cannot distract them away from the area of interest, and they do excel in these areas of interest. But another common characteristic is a problem in regulation of emotion. They're generally very nice people, but they have difficulty regulating their anger or their sadnesses. So they become frankly explosive when they get angry, but they're also quick to calm down. They're very often talented people, but generally restricted to one particular area. And they do very well in this. Some people with Asperger's, for example, would be very interested in computer work, and they know everything about the computer. They excel in the area that they like. Some people are interested in animation, in manga, and they become overly involved in this and they excel in it. Yeah, they do, because their social relationships tend to be limited in the privacy of their own homes or in their rooms. They do fantasize. They create relationships in their own mind. Many of them are very intelligent, very coherent and logical in their thinking, and they are very creative, but this creativity is generally limited to one area of interest. But generally, the medical management comes in only when there are what we call comorbid or coexisting conditions. People with Asperger's are very prone to develop anxiety, to develop depression, to develop sad mood and irritable mood. And when those happens, there is a medical treatment for that. They also need psychotherapeutic interventions like group therapy or even individual therapy when there are certain things that bother them. Now, what is the special need of a group of the people with Asperger's as a group? I think they need very badly a support group. We have always been very short in being able to provide support groups, but I understand from you that there is in fact an international bodies, Best Bodies International, and that we have now a chapter in Benil. That is a very heartening event to know. Well, among students, they stand out as they will be mistaken or misinterpreted as being aloof because of the difficulties of initiating a conversation or difficulties of establishing friendship. So sometimes it presents difficulties among peers because, well, that's the primary characteristic of people with Asperger's, that they have difficulties relating to others. I think if they're able to actualize their potentials, they have lots of potentials, they have lots of interest in singular things, if they can maximize that and find jobs and have support groups, they will be integrated in society.
And last question, what would you suggest that a school could do to mainstream Aspies?
Well, most schools now integrate. I know that I'm sorry, I can't really say most schools, no, but there are many schools now who really integrate Aspies. They're not separated from the mainstream of students. They attend regular classes together with their friends. So I hope that all schools will take the same measure. It's not difficult to do because many of people with Asperger's are also very intelligent people.